Good afternoon, everyone. Thank you for coming out. Our speaker today is Dr. Shanda Shier. Dr. Shanda Shier. She has been serving the Peel community for 20 years. Working out of the Credit Valley Wellness Center, Dr. Shier offers both chiropractic and acupuncture services in a warm and welcoming atmosphere, with a focus on preventative wellness. As a health-conscious doctor, Dr. Shier leads her patients by example. Today at the health fair, she will share her own personal experience with chiropractor and how it helped her to achieve a better health and shaped her career path as a chiropractor. Dr. Shier uses the activator method, one of the most widely practiced and researched chiropractic procedures, as well as the Thompson technique, which uses a special segmented table. These techniques are very gentle on the body and are well suited for patients of all ages, including patients with fibromyalgia and osteoporosis. Dr. Shier will custom tailor an affordable wellness plan based on your needs. Other services used to create a better health are low-level laser treatments, massage therapy, Reiki, and homeopathic. Most services are recognized by insurance company. So, Dr. Shier, thank you for coming.
And I'm just going to put some things up here. There's a table in the back.
There's a table in the back room, and she also has to leave early. So if anyone has questions and concerns.
Okay. So everybody can hear me okay from here? Okay. Well, it's nice to see people that come out to these types of events, because I think if you do have fibromyalgia, you're always looking for different things that you can try, because not one thing, nothing is going to cure fibromyalgia. So you're going to have to try a multitude of different treatments to then find what works for you. First of all, I'm a chiropractor and an acupuncturist. I've been practicing for 20 years in Mississauga. I see a wide range of conditions, a lot of people with chronic pain and fibromyalgia over the years, and I can definitely say chiropractic has definitely helped them. Not cured their pain, but allowed them to live a happier life and less pain, more mobility, get back to work, those types of things. So first of all, I just want to know how many people here have tried a chiropractor before? So, okay. And of these people, I just want to know who had a bad experience. That's okay if you put up your hand? Okay, because I hear that sometimes, right, that you've gone to a chiropractor before and had a bad experience, but don't give up, because each chiropractor can be a little bit different at the way they look at your body and the treatments that they offer you. So don't give up for sure. Chiropractic is a good option. What it does primarily is it helps to regulate your response to the environment, so it's not so hypersensitive to different stimuli. So what we do is we analyze the body and look at the spine to see if there's any connections there that are, we call them subluxated or misaligned. And then we use different techniques, specifically the adjustments, to open up those pathways so that your brain and your body can communicate properly and respond better to your environment. So it's just bringing your body into better balance. So you have less pain, so you have a little bit more energy, and that seems to help a lot of the patients. I'm also an acupuncturist, so sometimes we add acupuncture into those treatments. We work a lot with nutrition. We have also a homeopath on site. We have a massage therapist as well, and she does work with a lot of fibromyalgia patients and knows gentle soft tissue techniques that can work, because you have to be careful with massage and techniques that are very hands-on or pressure on the body with fibromyalgia. Sometimes that can be too much. So you have to go to somebody that has a little bit of experience dealing with these types of patients. So don't give up on chiropractic. It's definitely an option that's out there, and it's, if you are taking drugs, those types of things, sometimes we need those things as well, but you want to try to switch to a more natural approach to your treatment, and just have a multitude of things going on that can help you. Does anybody have any questions for me about what we do at the clinic, or anything at all. I like to just interact more than trying to give too much information.
So assessment, how do you do this assessment?
So when a
Because
patient,
most of the time, with fibromyalgia, we have a different reason for that.
everybody's different,
That's
right? So sometimes there might be some physical trauma, sometimes there's some emotional trauma that set it off, sometimes not. You don't really know what the trigger
How
is.
do you do it?
So when,
Manually or by questioning the person?
sorry?
Manually, do you have some kind of checkup or you?
Yes, so you would come in, I would do a detailed history, like going back to when you were young as well, way back. So
Yeah, also it take a
we-
long time to assess.
it does take a while. The first visit, you're there for about 2 hours. But that's really important to get all the information and get the person's background. So we assess you, we look at your posture, we do some balance, we look at the range of motion and how you're able to move different parts of your body. So we take all this information in. Sometimes I'll decide to do x-rays, sometimes not. That's covered by OHIP, your x-rays. Then on the second visit, we take a look at all the information and we try to tailor a care plan or a treatment plan tailored towards each individual, because not every fibromyalgia patient is the same. It's very different. There's a whole range of symptoms, and you guys all know this, but there's a whole range of symptoms included in that diagnosis. And, some of my patients will respond better to one thing versus the other, and you have to kind of find what works for each person. So there's a whole, appointment geared towards, taking the information in and looking at the body first.
But being covered by OHIP or?
No. So your x-rays are covered by OHIP, but any other care is either the patient pays out of pocket or it's covered through insurance, through work or personal insurance. So we do bill directly as well to insurance companies.
You keep cutting and you keep raising the prices.
So-
Or especially, so it is very hard to kind of squeeze yourself in.
Yeah,
Sorry, I'm saying
that's
that,
okay.
but-
That's being honest.
The first assessment, like how much is the assessment and the treatment right after?
So the first assessment, if you're coming in through the workshop, it's $90, and that includes your assessment and your second visit with your report. Okay, normally that would be $150. And if you refer any other people in from the workshop, I also do the $90 assessment. If you're just coming for a treatment, say you're coming for an adjustment, it's $45 a treatment.
But you have to know first what to adjust, right?
Yeah, like
So you
a.
have to do your own assessment.
So you have to go through the assessment first, and then that's when I put together a care plan, we call it. And that can save you money too, versus just paying each time you come in. I can bulk treatment together, and it can save a lot of money that way. Because it is the type of treatment that you can't just do one visit. It's something that's ongoing. Usually for the first 12 weeks, it's twice a week, and then after that, as the patient's getting better, it kind of staggers down to once a week, once every 2 weeks, once a month, that type of thing.
Do you also kind of advise, let's say, maybe to do certain exercises
Yes.
or not, let's say, do certain things?
Yes.
So it's not only what you do, but it's also kind of
It's part of the
our
program,
homework,
yeah.
let's say.
Yeah.
Our homework, right?
So it can't be just a passive type of treatment.
Yeah,
It has to be changes that you make with your diet, exercise. Choosing the right stretches or strengthening exercises is part of the program that we do for each person. So we tailor that towards what you need, right? Yeah, you're welcome.
When you said trying to do things more natural rather than like all the drugs, what do you think about CBD oil instead of, maybe just prescription drugs? Do you feel that that's a more natural approach, and have you found in your experience that has helped some of your patients?
Yes. For some people, it has helped them. Other people, it hasn't. So it's something that you have to kind of try until you get the right dosage as well. That takes a little bit of time for them to do that. If it is going to help, then it is worth trying to go that route versus taking the medications. But it doesn't help everybody. And it's really popular out there right now, and I think a lot of people think it's like the magic bullet, and it's not. It's just something else that can help if you're having pain, it can help minimize it. If you add the THC into the CBD oil, that's where you're getting more relaxation, and if you're having problems sleeping. So sometimes they do the CBD oil and then they add a little bit of the THC in there to help relax as well. And I find with a lot of my patients that aren't sleeping, I have a lot of sleep disorders, once they get that sleep and rest that they need, it really helps the symptoms, yeah. So it's something to look into. It's something that, there still is a cost for that patients have to pay out of pocket. I would say it's between about $50 and $90, depending on the company that you go with the oils, and that usually lasts you about a month.
So we are tired of all those medications that they don't
Yeah.
have. That's why we are looking for miracles.
That's right, and that's
Nothing
why.
wrong with it.
So there's no miracle, but you're right. The medications, the way the medical system kind of analyzes you, it's just piece by piece. Like you have depression, take an antidepressant. You have digestive issues, now you take something else. You have pain, now you take something else. And how's that affecting your body long term? And then it's not even really helping that much, right? So the downside is that the way that our healthcare system is, they're taking all the money away from the preventative care. So it makes it more, it's harder for people to access that, People that don't have the money to do that can't have the care. And that's unfortunate, yeah. So.
How did you get on your journey?
Oh, okay. So my journey was when I was, so I used to be a diver. Like I used to do springboard diver when I was about 12. And I had a kind of a diving accident where I hurt my neck. Then after that, I was starting to get really bad migraine headaches. So to the point where I couldn't participate in sports, I couldn't go to school, I was missing a lot of school, and even socially with my friends, I was starting to lose I was just losing my friends, and it was awful. So I went to a number of doctors, I was on lots of medications, Imitrex, a whole bunch of them. I had MRIs, CT scans, and they were saying that there's nothing wrong with me. So then my parents were seeing a chiropractor, and they mentioned, well, why don't you bring your daughter in? But they just didn't think at the time, well, why would I bring her in? She's a young person, right? They just didn't have that knowledge about why you should bring a younger person into a chiropractor. So I started seeing a chiropractor. I had to go 3 times a week for about 12 weeks or so. And then my headaches went away. And I've been migraine-free ever since. I get the occasional pressure headache. I mean, our environment here, there's always fluctuations, so I get a little bit of a heavy feeling sometimes, but it's nowhere near what I used to have. So it changed my life, and I decided then that that's what I wanted to do, is to help people and teach people why adjustments can help your body and how it can balance your nervous system and how you can live a better life. It's not the answer for some things. It can cure a headache. It can cure back pain, certain types, right? Chronic pain, it doesn't cure it. It just makes it more manageable for a patient to live a better life. Yeah.
You see what you said yourself, that you were so young, you did not think, and even the parents did not think.
Yeah, they didn't know.
Nowadays, we are older.
Yeah.
We are being told that at this age it's expected to have changes in your neck or in your spine.
Yeah.
So you still think that you can help us?
Yes, it's never too late. It's never too late to make changes. I mean, I always educate the parents that have children at home to bring your children in, get them checked when they're early, when they're young, because you can correct certain imbalances in the spine, depending on if they were like forceps delivery, or there's things that can happen in childhood that can set them up for problems in the future. If you can address those early on, then it can prevent a lot of things. Like some of us didn't know that, right? Even now, you can't, if you have arthritis or something in your spine, you can't cure it, but you can get things to be a little bit more mobile, take pressure off the nerves, and just work on nutrition, stretching, exercise, more water intake. A lot of us don't drink enough water, and that's a big one to flush out the toxins, right? But yeah, it's never too late. And that's one of the reasons why it's so important for fibromyalgia patients to know that keep trying. If you haven't tried a chiropractor, if there's one in your area, just go and see, or, give it another shot. Don't give up, right? Yeah.
It's interesting, just to piggyback about at a certain age, there's a lot of physicians, I don't know about people in the room, but the answer is, oh, it's just part of the aging process.
Yeah, you're just getting older. The's nothing you can do.
Well,
Yeah.
Part of the aging process.
Yeah.
You're going to have, deterioration in your neck. You're going to have a bit of deterioration in your spine.
Yes.
I heard
Yeah.
it years back.
It gets a bit
Yeah.
annoying to keep hearing that. Well,
Yeah.
like, yeah, you might be 50, 60, 70, but you're in your mind, you're a lot younger.
That's
And,
right.
It's like, well, I don't want to hear that anymore. What else can I do to help myself? So
That's right. It's unfortunate.
Commenting on that because it's frustrating to keep hearing that. Oh, it's just part of the aging process.
Yeah. I mean, that's just,
And maybe that's true.
so, yeah, I
We
mean,
knew the kind of
aging process.
well,
yeah,
I don't know,
that would be nice.
That would be the fountain of youth, I think.
Yeah.
But, just a bit more supportive in a collaborative approach to it rather than just, oh, it's part of the aging process, just go home and exercise. And then just kind of take painkillers.
Yeah, I mean, that's unfortunate that that's the way the kind of, not all, but most medical assessments, that's how they're done. Osteoarthritis is a disease that, it's wear and tear in your body. So it is going to show up as you get older, and depending on how you've used your body while you've been working, if you've had accidents, that type of thing is going to show up. There's definitely things that we see in our clinic that help those types of people and can kind of slow down that process a little bit. So that's what it's geared at. It's like controlling the inflammation that's there and increasing range of motion in the body, helping the communication, and working with your lifestyle. There are good doctors out there too. Like I have patients that come in and there's some that are very pro, okay, you're getting overweight, you're borderline diabetic. They don't just give you the metformin or put you on cholesterol drugs. They say, work on your diet and your nutrition, come back in 3 months, and then we'll take a look, versus just pills, right? And
Yeah, I think that's the other thing about nutrition. And it's very important, right? I think
very important. It's like your medicine that you're putting into your body is your food, right?
And it's I don't know how many of us have actually gone to a nutritionist. It's not sort of the norm. We get our eyes checked once a year. We go to the dentist once a year. We get pap tests once a year. Men get PSA
Every
tests
2 years
once a
now.
year, or whatever it is.
Every 2
But
years.
there's never been
Yeah.
in our society, go to a nutritionist.
Yeah.
It's not part of our culture or our society,
Yeah.
which maybe it should be.
It is one of the
Or
most
like
important
chiropractic.
things, yeah. I always tell people, like, if you can just walk for 30 minutes a day, they had a recent study that came out, I don't know if you guys are aware of that, but that's enough exercise to help your body, okay? If you have fibromyalgia, you're not going to go to the gym and lift weights or do anything, it's just, a gentle walk, 30 minutes is all you need.
So gentle, that do it too, right?
Just gentle, yeah.
Because sometimes I think, you call it walk, I said, I'm glad that I can do.
Even if you can move, right? Yeah. Just even if you can move. I mean, doesn't have to be a brisk walk. It's just moving your body, right? But I always tell people, they get so focused on exercise, right? So I would say it's 80% of your diet, and you focus 20% on the exercise. That's where the focus should be.
Is there, a study where they have a certain amount of people, where they would test you to see what type of food relating to fibromyalgia, what type of food is best for you to stick to get rid of the pain? Like you have pills where you do studies to
Yeah.
say, okay, this will work for cancer, and you have a study of 12 or 20 people. Have they done a study where food-wise?
I don't think they've done a specific study like that, but any type of disease or issue in the body is due to inflammation. And the research that's out there now is sticking to a clean diet. So if you ever heard of a clean diet, like staying away from certain things like white stuff, like sugar, starches, white bread, that type of thing, refined meats, things like that, processed foods. There's a lot of information about that out there that sticking to that type of diet works the best for controlling inflammation, which is cancer, which is fibromyalgia, which is heart disease, which is everything, arthritis. So that would be something that you'd want to look into. Clean diet, clean eating. I would say that's where the best, you're going to get the best results. Whether there's been studies on that, I'm not too sure.
Different doctors. There's a lot of different approach to healthy life now.
Yeah.
Not all of them are through the regular doctor.
Yeah, don't do all these fad diets. You know, you hear about keto and all these other diets, Dr. Bernstein, like, I mean, they work short term, but it's not.
There is a physician, some of you may have heard of her, it's Dr. I think it's Ginevra Lipton, and she just has released a book. I just ordered it. It's for a fibro diet. She herself has fibromyalgia as well as being the physician, so you might want to look at that. It's with Amazon.
What's her name anyway?
Ginevra Lipton.
Yeah, it's good to know. So I have some information on the table here, but there's also a display at the back. Now, this is what we use to adjust the spine and the joints. So it's very gentle on the body. You can adjust it based on where you're adjusting in the spine, but it just delivers a little impulse into the spine that kind of resets that misalignment subluxation and kind of resets that circuit.
How, because I heard at different places, and I read about it, that, let's say, accident, that's what was caused of my fibromyalgia.
Right.
Changes a lot of those things that you were talking about, but they also have an impact on brain.
Absolutely, it's all
What's your
connected.
theory on about it?
So it does. So the brain. So everything's connected. So the brain is connected to the spinal cord. That's connected to the nerves that go out to your organs, your muscles, your joints. Right. So when you have an accident, so whatever happened, right? So it affects your spine or your joints. So in those joints, whether it's in the spine or rest of your body, there's nerves there, okay? So if you affect those nerves, then the communication to the brain, right, is affected, right? So you have to have two pathways. So from the brain down to the body to give a response, and then to take in stimuli and respond, right? So if that circuit is disrupted, then that's where you get the issues. So that's what chiropractic is there to find those circuits that aren't communicating properly and help to release that.
So there's a lady about diet. She comes to Fibromyalgia group. But what I was trying to say and ask you now, if you do have some kind of studies that would underline what you just said, because you know a lot of times we are experiencing brain fog.
Yes.
After chemotherapy.
Yeah.
Which is fibromyalgia side effects, whatever you want to call it.
Yeah.
Or let's say I had concussion also during my accident, so the short-term memory is affected too.
Yeah.
So it would be nice if you kind of maybe, put those things, step by step, to people like us. Is there anything that you would be interested in?
So in doing a study, you
Kind of,
mean?
yeah.
Or
let's say some kind of, I don't know, case studies, whatever you want to call it. So let's say this way, because, as I said, after accident, short-term memory, it's gone.
Yeah.
Fatigue is gone, and a lot of things are, here. So for us, it's more like, if somebody told us, you have this, you have to start with this, you have to analyze how you feel this. So, so step by step kind of seeing bigger picture other than just, throwing at us, a lot of information that it's hard to process here.
Yeah.
You get what I'm trying to say?
No, I think I understand what you're saying. I think the best thing to do is to get assessed and then to go, to explain that process of how we assess you. There are studies, if you go to the Mayo Clinic website, you can type in fibromyalgia chiropractic. There are studies there showing patients' response to adjustments and for different things too, headaches, probably after an accident, that type of thing. So there are studies out there, but there definitely needs to be more. So.
Can you speak to acupuncture?
Yeah, what would you like to know about acupuncture? So that's a really wide range topic, but like just to give you kind of like the Coles Notes version of it. So about 2,000 years ago, they found that through the energy runs through the body through certain pathways, and they mapped all these out, and they relate to the different organ systems. And along these channels, there's different points. So when you stimulate different points, it creates a different response to the body. So when a patient comes in and they want to do acupuncture, you do an assessment, you do a history, you find out what's going on, and then you have to, like a prescription, you have to diagnose that patient based on what organ systems are involved, based on their symptoms. You pick the points to give the desired response. So if you want to reduce pain, reduce inflammation, if you want to help digestion, you add those points in. So it's definitely something that I find works well with patients that have fibromyalgia. Some get adjusted, and then they have certain acupuncture treatments as well. For some people, it doesn't work well, just the stimulation is too much. And you just don't know sometimes until you're working with somebody, right? But it does help a lot of people for different conditions. It's not just pain or inflammation. The biggest area that I'm involved in that is for infertility, actually. I kind of fell into that niche. There's a lot of people that were having problems conceiving. Women are waiting longer to have children, changes in the environment. And acupuncture can help to regulate the body, reduce stress, and I find that that's helped a lot of people. In conjunction sometimes with IVF or other medical procedures, but it works pretty well. I say 40% increased chance of conceiving if you have acupuncture as well. So it's definitely something to think about if you haven't tried acupuncture for fibro. Yeah. Yeah, you're welcome. Any other questions or anything?
I kind of just have a comment.
Oh, yeah.
It's almost, you're taking like a holistic approach.
That's right.
So what we need.
Yeah.
We go to the doctor, we have 10 minutes if we have 10 minutes.
Mhm.
We can only speak of one thing, and how do we navigate through all of that?
That's
So
right.
here, You're looking at the individual person and all, and through my own experience, and the support is the best.
Yeah, I think you really have to be there. Like part of, yeah, sorry, Mary, go ahead.
It is such an individual thing.
Yeah.
And you are addressing that, and that is the most important thing.
Yeah, every patient I see is different in the office. You don't treat one patient the same as another patient in the way that you communicate and the relationships that you develop with those patients too. I mean, it's definitely a positive part of the treatment, right? You listen to them, you talk to them, you try to give them solutions, and it's not just about the physical treatment. It's about everything else that comes along with the visit, I think. We have a very caring staff at the clinic, and if any of you guys want to come for an assessment, just give us a call. Or if you know anybody else that, not even just with fibromyalgia, but are having, been in a car accident and need to get better care or have any type of problems, then just pass along our information because maybe we can help them. So, and sometimes we can't. I mean, I see people that have had fibromyalgia and it's not the right thing, but you don't really know until you try. And then they kind of eventually find the channels that work for them. But for a lot of people, chiropractic does help.
What's the cost for your sessions for your chiropractic care?
It depends on what you're getting during the treatment. So if you're just coming in and having an adjustment, it's $45. If you're getting more of the services, then instead of charging you for each individual service, we bundle them together to save you a little bit of money. We kind of tailor what's called a care plan, and we give you like a discounted savings, and we give patients options for payment too. So you can pay in blocks, if you're paying over time, if that works for you. We do bill insurance directly, so if you do have any type of insurance, we can kind of do a combination, If say your plan was $500, say, and you had $300 of coverage, then we would ask you for $100, and then we would bill the insurance the rest.
Let's say you're working mostly on shoulder.
Again, that will depend on, what we put together for your package. It could be $45 a session,
That would be
or
manipulating.
so So that would be just the adjustment using the activator. Yeah, the little tool here. And some patients, that's all they need, right? Not including the acupuncture. That's a separate fee. But when we do bulk it together, we can offer you a savings. And we try to make it more affordable for people because a lot of people can't access this care.
A session of acupuncture, let's say you already told me $45 for.
Yeah.
A session for acupuncture would cost how much?
Yeah, it depends on the time. So if it's a shorter visit, it's
Half hour?
so half hour is $45. And if it's,
Acupuncture?
yeah,
Okay.
if it's a full
Hour?
hour and it includes other things like cupping, then it's $80, 85. Cupping? Yeah. Yeah, cupping, sometimes with people with fibromyalgia, it's a little bit too much. It's using, so you use different cups to like draw out toxins, but also you can use it to like massage or circulation, right? Sometimes it's too aggressive right away. Yeah. Even like touching certain patients. Like when I adjust patients, sometimes I can't adjust them right on the body with the activator. I have to do like a thumb contact and the vibration goes through my body to dampen that before it gets, that's how sensitive some people are, right?
One more
So-
thing, the initial assessment to assess the whole body, that would cost roughly about,
So normally,
you're assessing the whole body.
yeah, so whole body, normally that's $150 if you're just walking in, but any referral or if I do a seminar, I do it for $90. And then that includes your second visit, which is a report. We go through everything and come up with a plan. So this saves a little bit too. Yeah. But check your insurance and see if chiropractic or acupuncture.
I only pay $25.
Oh, really? Yeah.
Mine.
Yeah.
Go check it.
Yeah, but it's something though. It's better than nothing, right? Yeah. So.
But you have to have assessment first, right? And then go.
Yeah, I always assess every patient before I start treating them. Just because, you know, sometimes I've seen people and, you know, there's other things underneath, other conditions that I'll find that, you know, this isn't the right thing. And, you know, I'll kind of direct them towards a different area. So, you know, unfortunately, I've seen things on x-rays that are causing the pain that, you know, require different medical attention. But it's good to go to someone that does that. You don't want to go to somebody that just, oh yeah, come on in, I'll just adjust you, and they don't do any type of assessment. You want someone to take the time and to have the knowledge to know whether or not it's within your scope of practice or not. Yeah. 2000 Credit Valley Road, so just beside the Credit Valley Hospital in the 2000 building, so corner of, yeah, so the 2300 building is terrible. We do have parking, it's free, so I'm gonna tell you the hours that it's free, okay? So between the hours of 9 and 3:30, you have to pay, but before 9 and then after 3:30, because we work till 7, so we're there later. So that gives the opportunity for people that parking's an issue, it's less busier through that time, and it's free parking.
Sometimes the parking can be more expensive than your.
Yeah, it's $2. Yeah.
It's $2 what?
$2 for an hour. So, and the thing is, if you go there for your other doctors, just pay the $2 for the hour. Because the management there is great. They're just looking for people that are walking over from like parking there and walking over. Yeah. As long as you have your ticket and you're in that building, you're okay. Just pay the minimum $2. They're not gonna, if you're an hour late or 2 hours late, they know sometimes you're waiting at a specialist for 3 hours.
Are they really that nice?
Yeah, they're great. I mean, if any of my patients, yeah.
Don't tow you away.
But no, they're not gonna tow you away, okay?
I had treatment, some kind of test, and they were much too late. And my car I was taking off my clothes. I was wearing those little booties and this, this uniform, and it was cold, and I couldn't do anything.
Yeah.
And my car is poor because it was written that I don't know approximately an hour for the session.
Yeah, if you're downtown Toronto, like, you have to kind of pay for exact, or they'll like a minute over, they'll be there, right? But it's different at our building there. It's just pay for your ticket for the hour and you're good. Or come during the hours where it's free parking. So that helps people. I don't want that to be a barrier. the parking, so that's why we extend our hours so that there is that option for people to come in. Anyone else?
And you're able to send for x-rays, right?
Yeah,
You don't
just
have to go
downstairs.
No, I mean, we don't need to go to our family doctor.
No.
We're able to do
So I can prescribe those, and we give you a requisition, and you just go downstairs in the building. There's an X-ray facility, and then I can see the X-rays within 24 hours. Then I mark them up and take a look, and then we go through them. Everything's digital now. Speed of the film's very fast. Your exposure to radiation is very low. People sometimes worry about the radiation exposure, but as long as someone hasn't had X-rays in the past 3 weeks, it's okay. But if you've had like a CT scan or something like that, that's very high radiation. So if someone's just had something like that, sometimes I hold off on the X-rays for a bit because it's a lot of radiation in the body. All right. Oh, Mary.
Just one more.
Yeah.
Could you just explain one more time? I know you did, but so many friends of mine who say chiropractor, and no.
Yeah, they're afraid.
About
Yeah.
cracking,
Yeah.
about that. And could you just show the activator again?
Oh, yeah.
Because it is so gentle and
Yeah.
yet effective.
So it looks kind of scary when I show, right, what it looks like. But I can just show on, like, I'll just kind of demonstrate on your hand or your wrist. My hands are a little bit cold.
It's okay, don't worry.
So if you are adjusting a patient, I mean, obviously if you're adjusting on a joint that's small, you're going to have very low force, right? If you're adjusting in an area of the body like the lower back where there's a lot more muscle and tissue to go through, it's a little bit more, okay? So in a case like this, if I was adjusting somebody that had, say, carpal tunnel, okay? That's
Probably I do.
pretty common, right? Then I would so if I'm trying to open up those joints or the carpal tunnel, it's just a little click like this, okay? So really gentle, right? On the body, and that's enough pressure to do what it needs to do, okay? To move the joint into.
Doesn't hurt at all.
Yeah, it doesn't hurt. It doesn't hurt at all, but some fibromyalgia patients I have to adjust like this. Okay, I have to go through my finger.
Because that's what, sometimes we have days
That's
like
right.
that.
You have days where even touching your body is too sensitive, right? So, I know enough and I've had enough experience to work with those patients to know what to do. But yeah, it's great. I started getting adjusted like this and I changed my whole practice over because I just, I like the way to analyze the body. And then, I have another partner that I work with and we're able to, adjust for each other if someone's on holidays and it's the same. You're not going to go to one person that's really aggressive in adjusting you and you go to someone else that's totally different. It's one technique and it's the same.
Is that something we can buy and use? That
No, no, you have to go to chiropractic college, yeah. So be kind of expensive, yeah. No, you can't just kind of like click, like it doesn't work that way. You can actually hurt somebody, so you don't want to do that. You don't want to, I know on the shopping channel, some of our patients have bought it looks something like this. It's like a stimulator. I always tell them, it's not going to replace your treatments, but they do use it for pain, and it does help a little bit. Same kind of, you're not analyzing the body. They're just kind of pointing and clicking with the device. But,
So
yeah.
instead of using the hand to massage the area, you're using that. Is that
No. This is
So
something
no,
different.
this is like impulse thrust into the joint. So whether it's the spine or your elbow or your knee or your ankle or your upper spine, it's like a small little, yeah. And your body takes in that signal, goes to the brain, back down, and then things relax that way.
Normally, is it like a number of sessions you have to have, or it's individually, like one is enough, or other person is like 10 sessions is not enough? So how does it?
Yeah, so I've never seen where I can adjust a person once and they're fixed. It doesn't happen that way. I wish it was. I'd be like,
Required number of sessions?
yeah, usually it is, depending on like a chronic condition versus, if someone just put out their back, bending over, that might take 6 treatments, they're okay. But in a chronic condition, usually you're looking at starting off with twice a week for 12 weeks, and then you assess at that point, and then you start staggering back the appointment. So you're coming in less, And everybody's individual. Some people stay at once a week, and that's what manages their body. Some people are okay at once a month. Some people come in once every 3 months. It's just dependent on that patient. So you kind of find that balance, what works, yeah.
And also affordability.
That's right. Some people can, like, it's a little bit more expensive at the beginning, but then they can afford that once a month visit, and that's what helps with their, their management of their health. So, and some people, they just come for what they can come each year. Like, they have insurance, they only can come for that amount, and then they come back the next year. And in between, they have to focus on their exercise, their nutrition, the other things that they can do, and yeah, so.
And you use not only like hand manipulation and the finger manipulation, you use a physiotherapy as well, or not?
So there's a physiotherapist downstairs in our building, so we just send our patients down there if they need physio. We do laser therapy, acupuncture, the massage therapist is there, so she doesn't just do like, hard Swedish massage, she can do just gentle manipulation as well.
Will it cost for their fee, or?
Yeah, I believe she charges $45 for half an hour, and then $90 for an hour, I
What
believe.
about the laser treatment?
The laser's $35.
35.
Yeah.
And is that safe, the laser treatment? I'm thinking radiation.
So there's no radiation in that. So it's a low-level light.
Still not good because of the cancer. It could.
Yeah, if you have cancer, you have a pacemaker. I don't do it at all. If you've had any history of cancer.
Cancer, yeah.
Yeah, so pacemakers and any history of cancer, 99%.
Much insulin.
Yeah, I wouldn't do it because the problem with if you're introducing an energy like that into the body, there's always the chance that you can stimulate bad cell growth too. So I just don't touch it. Or if someone's pregnant, I don't. Yeah, I don't even bother because you don't want to even have a chance, right? It's better not. Yeah. Any other questions? I saw a couple people pop in here. Okay, I think that's it. Yeah. Thanks very much, everyone, for coming out. And come on by the clinic. Or if you have any questions for me, I'll be around for another half an hour or so.